Hi, everyone. My name is Jared Castanedi, Capacity Building Coordinator at the AETC and CHCMC. We're going to get started shortly so everyone who registered can log on. Just as a reminder, you can review the instructions for using the WebEx by visiting the Virtual Learning Lab's FAQ page. I also wanted to remind you that the webinar is being recorded and it will be posted on the VLL. If you want to ask a question, please submit it via the chat function, and we'll answer it at the end of the presentation. Starting today's webinar is Brad Ward. Brad?
Good morning, everyone. Thank you so much for joining us for this webinar to talk about the HIV training package. Today, we will cover a few topics in this presentation. First, we will review what the training package is and some of the methodology that we use to create it, what its contents are, how you can use it, a discussion about the implementation of the training package, and then we'll highlight next steps for you, and then we'll open it up for questions. Part of the AETC NCHC-MC program is to improve access to HIV care and treatment by increasing the size and capacity of the HIV provider workforce. The objectives that support this are to provide training resources and methods for health centers to use to begin to deliver or improve delivery of on-site HIV care and treatment, and to develop and test effective, efficient, realistic, and replicable distance learning models to increase access to HIV care and treatment. So what is it? The training package is based on a conceptual model that includes standardized in-service distance learning for busy primary care providers. It's based on stages that we presented at the launch meeting, and it's based on two core materials, the HIV/AIDS Bureau's Guide for HIV Clinical Care and the Department of Health and Human Services Guidelines for HIV Care and Treatment. The HIV training package is based on assessments to prioritize your own self-assessed learning needs and is dynamic and will include regular additions and updates to reflect resources and clinical advances. These updates will occur every 6 months, and we will use evidence-based resources included in the updates. Additionally, it will be supported by clinical consultation delivered by the regional AETCs. Right now, Stage 1 resources are available in the Virtual Learning Lab and the HIV training package. The objective is to move your care team one level from Stage 1 to Stage 2. Participants in this call are all organizations that have been designated at Stage 1, and the Clinical Learning Action Plan, which will be covered later in this webinar, provides you an opportunity to agree or disagree with your stage and to assess how we can determine how we can reassess you. The purpose of the training package is to solidify your knowledge in the current stage and prepare you to move ahead. The training package released last month contains two main parts, learning resources and tools. The resources are based in proficiencies and are responsive to and include resources for both prescribing providers and RNs at this level. The four components of the training package are the Clinical Learning Action Plan, which we'll cover first, and is something that indicates that you need to respond to, a user's guide, a monitoring framework, and a tool to introduce the package to your care team members. The HIV training package is holistic in nature. It addresses the needs of all the people on your care team, from providers to MAs and other supporting care team members. The result, we hope, will be more efficient, effective HIV care and treatment service delivery. And with that, I will hand it over to my colleague, Christine Stewart.
Thank you, Brad. So the next thing we want to bring to your attention is the Clinical Learning Action Plan. We have a screenshot of the plan listed here. We do want you to please briefly review this before you review other resources within the Virtual Learning Lab. It's the only document that's now posted that requires a response from you and your team. You can access the action plan in the private forum that's been created for you in your health center on the Virtual Learning Lab, just so you know. So I just want to let you know the few things that we want you to pay attention to on the action plan is the names and roles of people that we'd recorded as being part of the care team of your organization. Please review those names and verify and update and add more if necessary. We also want to make sure that you feel the stage that we've identified with your care team or for your organization is correct. So please do make sure that you review that carefully. And we also want to see if the training date that we've identified is realistic for your organization. And please do respond by submitting this form electronically to AATC and CHCMC. And this can be submitted by email or on your health center's private forum in the virtual learning lab. The next item we'd like to discuss is the user's guide. And again, here's a screenshot of what it looks like. On the next slide, we just have an overview of what's inside of it. And I just want to briefly explain what's in the user's guide, and then we'll review each part in more detail. The user's guide provides detail on the content and the format of the training package. It explains the steps to develop a tailored training package, and it discusses several options to monitor the progress of your care team and the achievement of the proficiencies in each of the menus. The next one main part of the training package are the curriculum menus. The curriculum menus are the foundation of the HIV training package, and they identify proficiencies required to provide HIV care and treatment, identify the recommended core, and have supplemental learning resources for each proficiency. And we've also included the specific page from each resource material, so you don't have to go searching through each of those resources for the appropriate topics. The next several slides will provide more detail on the curriculum menus. So here we have some key elements of each of those menus. There are one-stop shops to access the learning resources for each proficiency. We provide direct links to multiple sources and types of resources. The emphasis is on learning resources that offer Category 1 CME or CE credits. And we also will be regularly updating and maintaining those resources to make sure that they're up to date. The menus are divided into core resources and supplemental resources. The core resources, depending on whether the learning resources are directed towards prescribing clinicians, RNs, or other members of the health team, are primarily from the HIV/AIDS Bureau's Guide for HIV/AIDS Clinical Care, the Department of Health and Human Services guidelines, our AATC and CMC webinar series, which are archived or can be accessed live as well, and the Association of Nurses in AIDS Care, or ANAC, core curriculum for HIV/AIDS nursing. Please note that the HAD manual that I just mentioned is not currently available in hard copy. We did provide one to each health center during the launch meeting. We've included an option to download the full manual on the VLL. The RN curriculum is based on the ANAC book, so we'll be sending each of you a copy very soon. As soon as when we receive the clinical learning action plans, we'll send those to each of you in December, one per health center. And that book is also not available online, just so you know. Next, I wanted to show you the HIV curriculum, the supplemental resources. These are optional for the team members if they want to access additional material. And these are just to complement the core resources. Again, the core resources we just feel are necessary and establish the foundation. The supplemental resources provide a variety of formats to reflect your personal learning methods. So we have things in a variety of formats, both online and print. We suggest our resources from our sister AATCs. We provide textbooks, journal articles, case studies, CME activities, and other resources to fit your learning needs. And here is an example of one of our curriculum menus. This is the Word version of the curriculum menu, which contains the recommended learning resources and associated links in list form as you see above. Right here in this shot, we have the an example of the provider menu, Proficiency 1 as an example. Each proficiency has the same format in Word version, just so you know. So again, we offer the curriculum menus, all of them in Word, but we also offer them in Excel version. And the Excel version just contains the same materials, but it's has the associated links in table format. And again, here is a screenshot. And then here is some examples of how you and your care team may decide to use the learning resources in the curriculum menus. You can work individually by yourself and then come back and discuss that with a team member. You can review the materials with a group, or divide that up by team members in the same discipline, in multidisciplinary teams, or you can review the materials with your clinical mentors. And so the steps to develop and implement the HIV training plan. Once you download the curriculum menus, please lead your team through steps 3 and 4 on this slide and review the proficiencies and menus. Recall their answers on the self-assessment form they completed and decide which proficiencies they would like to work on as part of the training. If no self-assessment forms are completed by your care team members, just review the proficiencies as they're currently stated in the menus. We'll talk a little bit more about, in detail, about step 5 after reviewing all 10 steps. Now, work with your team on steps 6 through 9 to add information to the draft training plan. So ask your team to estimate how long it will take to complete their learning resources, establish the needs for additional support, develop a method and time frame to monitor your team, and establish benchmarks or milestones and outcomes. And I just want to call your attention to step 10, this is important, anticipating possible system barriers. This is because no matter how good your training plan is, if there are system barriers that will prevent you from actually implementing the plans, your desired training outcomes may be compromised. And next, our newest member of our clinical team, Stefan Perez, will discuss the training plan.
Thank you, Christine. So now that we briefly covered the steps in how to develop a training plan, let's talk more about what the components of a training plan are. A training plan includes schedule or training calendar, specific dates, times, frequency of care team training activities, proficiencies and topics selected included in a group and individual training plan, anticipated date of completion of each proficiency for each team member, roles and responsibilities of each care team member to accomplish team training goals, and method and frequency of assessment of care team training activities. Ask care team to review with you the curriculum menus, proficiencies, and learning resources for each type of team member. Select priority proficiencies, realistic individual and group timeframes, maybe 1 or 2 proficiencies per week as time allows, and delineate clear roles and responsibilities for each care team member. For example, can some members mentor others with less developed HIV skill sets? Discuss the method and time frame to assess and monitor training activities. Establish goals and objectives, benchmarks and milestones. Decide how the team prefers to demonstrate evidence of learning or progress towards training goals. And most importantly, let us know if you think you'll need assistance in developing your training plan. This is an example of the monitoring framework and monitoring HIV training progress. Suggest 5 criteria to monitor HIV learning activities for each proficiency in curriculum menus. HIV training resources, materials introduced, HIV training resources, materials individually reviewed, completed, and HIV training resources, materials discussed in group forum,
mentorship in individual proficiencies received, if required, and proficiency applied in the actual practice setting. This is a simple monitoring framework that contains 5 basic process indicators to provide information to you and the AETC, NCH, CMC on your team's use of the package and resources. They are not outcome indicators to measure effect on care outcomes. If you develop other monitoring methodologies, including a framework based on outcome indicators, please share it with us, or again, we can assist you to develop these further. So next steps in the HIV training package. The training package and curriculum menus are dynamic. Additional curriculum menus will be available by early 2012. Coming soon are Foundation, General Topics for all care team members and HIV testing, HIV Curriculum Menu for Providers, Stage 1, Part 2, HIV Curriculum Menu for Providers, Stage 2, HIV Curriculum Menu for RN, Stage 1, Part 2, HIV Curriculum Menu for LPN and Medical Assistant, Stage 1. Learning resources that meet the criteria for inclusion in the curriculum will be updated into the curriculum menus every 6 months. New tools to help you with training will be posted as they are developed. So next steps in the virtual learning lab. Available now on the Virtual Learning Lab is access to HIV training package, learning resources and tools, and a private forum for care team discussion. The Virtual Learning Lab is your portal to access the HIV training package. Also, you have individual forums where you and the team can share experiences, questions, and plans as you roll out the materials. The forums can also be used to ask questions of the AETC, NCH, CMC staff, as you already know. Coming soon to the Virtual Learning Lab, our new forum for clinical discussion that includes interactive case study and expert review, and interactive discussion of HIV topics of interest with clinical specialists. Also, care team members are welcome to suggest learning resources they think could be included based on the criteria for inclusion into the curriculum. Team members are also welcome to suggest articles or resources that may not be appropriate for the curriculum, not evidence-based, or findings that are still preliminary. And these will be posted elsewhere on the Virtual Learning Lab for care team members and others to review and share. Okay, let's talk a little bit about implementation issues to consider, including participation in motivating care teams. Individual and team professional development in HIV care equals improved service delivery. Contribute to development, testing a standardized national HIV distance learning model. As we said earlier, environmental factors in your practice setting can influence the ability to carry through on even the best training plans. Let's talk a bit first about how you can explain to your organizational leaders and your care teams why it is important to participate in the clinical part of the program. Some more implementation issues to consider: how to maintain momentum of HIV learning activities. This can be done by getting staff buy-in, identifying learning incentives, develop internal care team learning partnerships, the availability of senior staff to coordinate, participate, and monitor, integration of regular team learning events into schedules, and manage competing priorities, and linking with external learning partners. If interest wanes, let's talk about some ways to re-energize the team and strengthen HIV training activities. So, we understand that we've provided a lot of information to you just now. So let's talk about some of the next steps that we want to highlight. If you haven't already done so, please download the HIV training package from the Virtual Learning Lab. If you're having trouble logging on or don't have a login, please contact Jarrett Casanidi. His contact information is on the next slide. Second, we are requesting that the clinical learning leaders access your health center's clinical learning action plan and return it to us electronically. This is a priority, so please do this week. Third, Work with your team to develop a training plan using the resources in the training package. If you need help, as always, please feel free to contact us. In the meantime, we will be reaching out to you to see how you're doing. So now we would like to open it up to any questions or discussion that you all may have.
Thank you very much, Stefan. And now on your slide is a list of contacts. And I also wanted to thank everyone for participating in today's webinar. The recording of today's webinar will be made available on the Virtual Learning Lab. While you're there, please post your follow-up questions to the forums. You can always reach Brad, Christine, Stefan, or any member of the AETC NCHCMC clinical staff by emailing clinical@nchcmc.org. Thank you very much, and enjoy the rest of your day.